Hi, I made one video on causes of varicose veins, and I think this is the most important video if you suffer from varicose veins. And it's very important for you to find the causes, because if you know the causes, then you'll know how to correct the cause and prevent this varicoses from happening. And today I'm going to discuss with you on the symptoms and signs of varicose veins. And for most people, varicose veins are simply a caustic concern, and for other people, based on disease stage, and varicose veins can cause many different signs and symptoms. So, generally speaking, that varicose veins can have 6 stages, and so you need to know the different stages and take a different approach. I think it's also very, very important. And stage 1, and that's a very early stage. You only have spite 1, and because the vein looks like a spider's web, so it's very, if you don't sit very carefully, you may not see it. So if you don't take action in stage 1, and then the disease can reach stage 2, usually we call this reticular veins. That is the spite ones, many spite ones fusion together become reticular veins. And stage 1, stage 2 is very important for many people to know this, because when you are at this 2 stage, and you find causes for this spite 1 and reticular veins, and this potential, you can reverse this the illness. So if you don't take any action, usually the veins, spite 1 and reticular veins, will be progressed into varicose veins, and then you usually can see large and twisted and more diluted veins. Usually happens in your legs. And when this reach stage 3, usually you need to take medical treatment in order to reverse this varicose vein. And if you don't take action at this stage, and then disease can first progress to stage 4, and then you can see the swelling of the legs. We know that the varicose vein is the cause because the waves of the vein is not working, so the blood cannot return to the heart, so the retain in the legs. That's the cause of the swelling of the leg. And this stage is first developed into stage 5 and cause kind of a pathological change. You're going to have skin discoloration, the color change of skin, and that if you still don't take action, you can reach final stage. You have open wound and ulcers in the leg. Here we're going to see some pictures on this different stages of varicose veins to see the signs. Here's spite 1, the vein like webs of spider, and so many spite 1 fusion together become reticular veins. And if you don't take action in this 2 stage, the veins become larger, and then you can see the very clear signs of varicose vein. And because reach this stage, these clear signs, the blood will retain in the leg and cause swelling of leg. And furthermore, and this leg may become discoloration. You can see the color change, and then we reach final stage, and you're going to see this answer. And so let's see more specific cases on this different stage. And here's showed that's the spider ones. It's like a spider and like a web. So it's a typical spider web. And here you see that many spider ones fusion together and then become reticular veins. Again, in this two stage, if you know the cause and also take active action to prevent from this happen, this chance you can reverse this causes. So and this spider ones and reticular veins can be disappear. You are going to have a normal leg. And if you don't take action, you go to this stage, you can see clear signs of varicose veins. You see this is enlarged veins, and it's twisted, and sometimes there's a clear color change. And when the varicose vein reach this stage, and you need medical treatment in order to remove this varicose vein. That is, if you still don't take action at this stage, the disease will be surely progress to next phase, and this is swelling of the leg. We know that the varicose vein is because waves of the vein defect, and the blood will retain in the leg, thus cause the swelling of the leg. And because there's so much swelling in the leg, and they cause discoloration because the red blood cells get out of the vein, and this some of component in hemoglobin, such as iron in the blood cells, and so that's why it causes discoloration of this veins. And if still don't take action, will surely that reach most serious stage. This stage, varicose vein ulcer can be very serious, and sure become disparity. So, but however, even you reach this stage, and if you seek some medical treatment, and that still can be recovered. You can see this is treatment, with this ulcer, you still with treatment, and you still can recover from this varicose vein, even so there are some scars. Yeah, here today just show you the different stages of varicose vein. Again, try to take action in the early stage, stage 1, stage 2, and when you find you have spider ones or reticular veins, take action, find the causes, and to try to remove the causes so you can correct the causes, and then you take action, and usually the varicose vein can be completely removed. And this is the video for today. I wish you healthy and happy, and I'm going to see you in my next video. Thank you and bye.